Dr. Alex Berka. I wanted him to share his story before. How's he? Yes.
Okay. I will tell my story, and I will try to make it not too long. I will tell some
25
stories.
minutes.
Okay. So I studied school medicine. It took me 7 years to make the first degree as a medical doctor, then 6 another years in specialized education as an orthopedic surgeon and conservative orthopedic. And we learned many things. And what I want to tell you at first is our point of view. Because you don't know our point of view because you are not medical doctors. So, is that bad? No, it's good that you are not medical doctors. What I want to tell you now is the other side. Why we do things we do. Because we learned that if the patient is coming in, we are drilled to find a diagnosis. Sometimes you let them tell the story, but you are educated to interrupt them early because you are thinking, I have the diagnosis already, stop talking. We will do some extra diagnosis. And thank God that all the science has built these funny things where we can do extra diagnosis. Ultrasounds, X-rays, we love X-rays. Even better, MRIs or CTs. And when we produce these diagnosis things, we are praying. Why do we pray? Yeah. We hope to find something damaged. Because if there is no damage, the patient must be crazy. It cannot be true that he has symptoms. Sometimes we have some medicaments if people are crazy. We give them to them and then our case is done. Okay. So, when we just hang up the X-rays and we see, thank you, there's arthrosis here or it's arthrosis in the hip. Arthrosis in the hip means I can replace the joint with the heavy metal. Plastic and a head of ceramic, and it will fit well. It looks nice in the X-ray after the surgery, but we have to tell the patients, maybe I do it 1,000 times a year. Maybe you are 1, 2, 3, 4, or 5 of the patients where there is some complications. I had never complications in my surgeries, but it is also possible that you have complications. Don't forget it. Describe here, and we will start tomorrow. Okay. Sometimes surgery is good, and sometimes surgery will help. You can replace the hip with a prosthesis, and it makes sense if this man has no chiropractor. If this man with a hip arthrosis has a chiropractor, it doesn't make sense to replace the joint. But if this poor people has no chiropractor, you can start with this therapy at first. So, what I learned when I come here in chiropractic is at first philosophy. And it was like Christian said, we are sitting here and here in philosophy and hey, what about the techniques? What can we do to start something? And the second time we said, can you start with these 3 hours of philosophy you did yesterday because I want to think a little more about what we did before. So, who of you is missing abilities from medical doctors right now or still? What are you willing to do what we do or what I did in former times? Is there anything? There's nothing. You can use medicaments. They are perfect to vanishing symptoms. My job was to let the people show me where the point of interest is, and I can stick such a long needle as fast as I can in the body of the patient and put 5 to 10 milligrams cortisone with anesthesia in it and say, okay, if it works, come back next week, we do it again. That's our job. What does it? It's vanishing the symptoms, and we were praying that the body does it works until the next time we see them back. That was our job. So that means vice versa. What are you for as an orthopedic in treating people on a conservative way? You just entertain them and praying that they do anything that the body is able to heal the problem. There's no need for a conservative orthopedic in a daily life, in a subclinical stage. That's what Mark said. So, school medicine is absolutely failing in a subclinical stage. School medicine is very worse if you have an accident on the street. You can save lives. Achim knows this because he had done it for years. That is very important. We need it, but you don't need it, and it has a great potential to damage or to put something bad to a patient in the daily life. Yeah. So, it was, how did I get to know about chiropractic? It was, my colleague Carsten is not here today, is my best friend, and we do in the office now since 8 years in Geilenkirchen. And he was on an osteoporosis congress. And he met, very funny story, he met Ralph and Julia, and they started the education here at Mark. And they were sitting on a round table in the evening, drinking wine, and there was an orthopedic colleague, and he was laughing about because a patient tells him last time that his headache's coming from his cervical spine. And he cannot stop laughing how such an idiot this patient was. And then a discussion starts on the table. So there were two meanings. Half of the group was at the opinion from the orthopedic colleague, and the other group was yelling at them. And the other group was Julia and Ralph. So, and then Carsten started to talk to them, and then, okay, I'm now interested in what you are doing. What are you doing? And they said, we do now American chiropractic. I'm a general medical, and my wife is orthopedic specialist, and we give no injections anymore. And we have more patients than we had before, and we earn more money, and our job is getting better and better because it makes more fun. And Carsten said, wait a minute, I call place. And I was in the hospital on duty, and he said, hey, I met you guys, and they are telling a story about American chiropractic. We did this chirotherapy thing you just imagined, but it must be something similar, but even better, I think. They told me that they give no injections and that they are more successful than ever. I said, okay, let me think about it. That must mean, A, they are totally crazy, or it must be genius. What should we do? What can we do? I said, okay, give me the number from this guy from Hamburg, and I try to phone him up. So the next day I was sitting in my room in a hospital, and I was thinking about, shall I call him or not? I had fear to call him, because when I now call him, that means my life will change. So sometimes fear is stronger than the need to change. I was so proud that I fight my fear and called him up. And I said to him, my name is Alex, I'm an orthopedic surgeon from a hospital in near of Cologne. I heard of you, and my question is, can I come to you and can I see and hear more about chiropractic? And he said, oh yes, it's very nice. I don't know whether I can let you do this. I said, oh, I said, but here's my suggestion. Come to Hamburg and join a weekend with us, and after the weekend I will tell you whether you are allowed to come in my group or not. Think, oh, what? We just sit on a train, drive to Hamburg, and come here, and we were so glad Julia and Ralph was here because we have something we knew we can pick on, that we are not not too alone, and we were scared that somebody can hurt us, because somebody can say bad things about us, because we knew we getting in a new group, and they are all not medical doctors, and we knew there are little prejudices, Vorurteile, against medical doctors, and what we like to live our life was everybody should like me. So now we get in a new group, and maybe there are people who don't like us, but we want to know more about what they are doing. So to make it short, Mark let us in, and we learned a lot of philosophy and some chiropractic techniques, and every time we drove back from Hamburg by train, in a car, or in an airplane, it was always the same. We start talking excited like children coming from a birthday party. A little too much information in our stomachs, but totally excited and upset. And we said, how could that be that we don't know it before? So we start our journey to become more and more a chiropractor, and now I'm talking about fear. The thing is, you learned as a medical doctor that the patient is coming to you, and he has his heavy back, and he pulls this heavy back with all his sorrows and pain and dizziness and diseases or whatever on your desk, or even worse, on your shoulders, and then the patient is leaning back and says, it's your time. Okay, so you learned all the tricks. You have the diagnosis, and then you do your procedures, surgery or medicament. But what happens when it doesn't work? Or what happens when patients ask you why that could be? Why your body is reacting now like it does? And then the problem is, as a medical doctor, you have to have the answer. Let me tell it in another way. The children of my girlfriend, they are always saying to me, oh, you are so good in inventing fairy tales. Where did you learn it? And I said, I am a medical doctor, and my job was 6 years So, we try to quit all these things. And the hardest thing for everyone, and even to be a chiropractor, is, and I talked about that yesterday with Mark, is the improvement. And I have a few sentences which I have burned in my brain, which Mark is telling me, and even if I have the darkest hour of desperation, I just remember these words. It's what's your job? It's to be a servant. If you hesitate, adjust. And there are even more. But the fear is, the problem is the focus. Don't lose the focus, and don't think you are responsible for what is happening to the patients, and don't think that you have to have an answer of any of their questions. You have not. And there's nothing on the old side behind me which has more value than you're doing now. Being a chiropractor means you have to work on yourself to give every day, in every adjustment, the best you've got. It's not possible at any time, but you can try to reach these 100%. if you have a day where you give the whole 50%, you will get the rebound 1 week later, because patient will tell you. So it is nowadays we make some things good, but we still make a lot of things bad. But what we do, and is very good, is to training our focus to change the things to be better. And in the medical days, you was telling me, in his education, there is a philosophy club. In a chiropractic education, there are people who are sticking together and building a philosophy club. I don't know any medical university where is a philosophy club. Okay. So what changed? What changed between the days as a classical medical doctor to now? It changed that you are feeling much more free. And you have an idea of that you are able to create a fun place, like Mark said. It isn't the fun place at all at 100%, because at the beginning you are still fighting against yourself, you are against your belief system. Sometimes you are too weak, you are getting back in older belief systems, and then you have to awake. And what you have to do is just to visit any philosophy class, just to name it, to do it like in Tibetan Gebetsrolle. You have to do it every day. It's so easy to fall back in bad belief systems. But if you train it, you will find out that everything is possible. And if something is in your office, it is not like it should be. It is depending 100% direct proportionally to what you are doing or what you are saying. And the most effective way to be happy is to find a way where are you comfortable with, and to tell the people what chiropractic is and what is your job and what is not your job. So that's my point by now. I'm so glad that I did the change, and I cannot say it as often as I should. Mark made me able to make the transformation. And my life is now completely different before the former times.
What did you tell me yesterday? In the restaurant.
About the fear?
No. About what's fun about being a chiropractor. Nothing to do with philosophy. That none of us as chiropractors ever thought about that. Probably nobody in the room did.
Oh Lord, I have Alzheimer's. Help me out. What did I say to you?
When you were a doctor, did people want to come to you? When you were an orthopedist?
Yes, yeah, that's the thing. So, how can you get people coming in to your office when you are a medical doctor? It's very easy. You take a plate and you write on the plate, I am your Kassenarzt. You put it on the wall, and one day later, you open the door and 30 people are standing in front of them and coming to you, not because you are the famous Kassenarzt. It's because of you are the Kassenarzt who is there in this building, and all the people around coming to you because they have to. If they want anything, they have to come to you because they have the insurance. They only pay when they come to you. So, what happened when you are a chiropractor? At first, you need a plate too. And you write on the plate, I'm a chiropractor. And then you put it on the door. And then the next morning, you are praying when you open the door. Oh, please let this in. at minimum one. So nowadays it's you open the door and they're standing 10 or 20, sometimes 70 or 80. And the thing is, they are all coming because they want to come to you. There is no need that they have to come. They made, and now I use your words, they made the decision to come. And that is the biggest difference between former times and now. Okay.
Alex, did you got any problems with the other medicine guys around?
Yes. They thinking we are in the middle of nowhere because our former colleagues are hating us, and the other ones who are thinking they are the only one who make pure chiropractic, saying we are medical bastards. Sometimes that happens. Yeah. It's just mostly by the American guys. We don't care. We don't care. We have lots of patients who come in. We are happy. We are earning our money, and the most important thing, we have fun every day, and it should be more and more. And I'm so glad that I'm now standing here, and I will go on. And constant improvement. That's what I like to do. Thank you.